Pharmacology MCQ by Timothy. Let's dive into some intriguing questions. Botulinum toxin blocks the release of acetylcholine from cholinergic nerve terminals, which is a possible effect of botulinum toxin. A. Skeletal muscle paralysis. B. Improvement of myasthenia gravis symptoms. C. Increased salivation. D. Reduced heart rate. Correct answer equals A. Acetylcholine released by cholinergic neurons acts on nicotinic receptors in the skeletal muscle cells to cause contraction. Therefore, blockade of ACH release causes skeletal muscle paralysis. Myasthenia gravis is an autoimmune disease where antibodies are produced against nicotinic receptors and inactivate nicotinic receptors. A reduction in ACH release therefore worsens, not improves, the symptoms of this condition. Reduction in ACH release by botulinum toxin causes reduction in secretions including saliva, not increase in salivation, causing dry mouth and an increase, not reduction, in heart rate due to reduced vagal activity. A patient develops urinary retention after an abdominal surgery. Urinary obstruction was ruled out in this patient. Which strategy would be helpful in promoting urination? A. Activating nicotinic receptors. B. Inhibiting the release of acetylcholine. C. Inhibiting cholinesterase enzyme. D. Blocking muscarinic receptors. Correct answer equals C. Activation of muscarinic receptors in the detrusor muscle of the urinary bladder can promote urination in patients where the tone of detrusor muscle is low. Inhibiting cholinesterase enzyme increases the levels of acetylcholine, and acetylcholine can increase the tone of the detrusor muscle.
Activating nicotinic receptors is not helpful. Inhibiting the release of acetylcholine or blocking muscarinic receptors worsens urinary retention. Which of the following drugs could theoretically improve asthma symptoms? A. Betanesol. B. Pilocarpine. C. Pyridostigmine. D. Atropine. Correct answer equals D. Muscarinic agonists and drugs that increase acetylcholine levels cause constriction of bronchial smooth muscles and could exacerbate asthma symptoms. Bethanechol and pilocarpine are muscarinic agonists, and pyridostigmine is a cholinesterase inhibitor that increases levels of acetylcholine. Atropine is a muscarinic antagonist and therefore does not exacerbate asthma. Theoretically, it should relieve symptoms of asthma, not used clinically for this purpose. If an ophthalmologist wants to dilate the pupils for an eye examination, which drug/class of drugs is theoretically useful? A. Muscarinic receptor activator, agonist. B. Muscarinic receptor inhibitor, antagonist. C. Pilocarpine. D. Neostigmine. Correct answer equals B. Muscarinic agonists, for example, pilocarpine, contract the circular smooth muscles in the iris sphincter and constrict the pupil meiosis. Anticholinesterases, for example, neostigmine, physostigmine, also cause meiosis by increasing the level of ACH.
Muscarinic antagonists, on the other hand, relax the circular smooth muscles in the iris sphincter and cause dilation of the pupil, mydriasis. In Alzheimer's disease, there is a deficiency of cholinergic neuronal function in the brain. Theoretically, which strategy is useful in treating symptoms of Alzheimer's disease? A. Inhibiting cholinergic receptors in the brain. B. Inhibiting the release of acetylcholine in the brain. C. Inhibiting the acetylcholinesterase enzyme in the brain. D. Activating the acetylcholinesterase enzyme in the brain. Correct answer equals C. Because there is already a deficiency in brain cholinergic function in Alzheimer's disease, inhibiting cholinergic receptors or inhibiting the release of ACH worsens the condition. Activating the acetylcholinesterase enzyme increases the degradation of ACH, which also worsens the condition. However, inhibiting the acetylcholinesterase enzyme helps to increase the levels of ACH in the brain and thereby relieve the symptoms of Alzheimer's disease.